Hi Kathleen, my name is Kristen. I'm going to be your interviewer today.
Hi, how are you today?
I'm good. How about you?
I'm well.
So, what makes you want to apply for this job in the OR?
Well, it's been my dream since I was probably 15. My mom's an OR nurse, so I've been able to see some cases that she's done, and just it's very exciting to me. There's always room to learn in the OR, and I love that.
Um, Tell me what success means to you.
Success means to me meeting your goals, but I think it also has to do with not being afraid to ask questions. I think success has a lot to do with working as a team to meet that goal. And I know we all have certain standards, so when we all work as a team to reach that, I think that is what success is.
Where do you get your sense of motivation?
Sense of motivation. I'd say I get my sense of motivation from my patients. Being in the OR, I know that's a very scary place for the patients, so in order for me to be motivated to make them comfortable, really comes from them.
And what course did you get the worst grades and why?
That's a really good question. The course that I got the worst grade was probably my pharmacology class. I really struggled with grasping the content. It was our very first semester in the nursing program, so I was nervous. And I ended up coming out well in the class. Since then, I've had to, review my drugs more frequently than some other students, but because of that, I feel like I do know my medications better, just having to review it all the time.
Okay. Why are you the best candidate for this position?
That's another great question. I would say I'm the best candidate for this position because of how much I care. I will do anything to make my patient comfortable. If they need me to hold their hand until they fall asleep, I will do that. If they need me to try to distract them, I'll do that. I'm very patient-oriented, and that is why I wanted to become a nurse in the first place.
Would you call yourself a team player, and how would you describe yourself as a team player?
I would say I'm a team player. In the OR, I know we definitely do have to work with all the other health professions in the room at the same time. I think nursing in general is a teamwork profession. A lot of times we can't get something done with just ourselves. I think I would probably describe myself as a team player because I like being able to lean on people. I like people being able to trust me. And I played sports for many years, so I have that background of working together with multiple people. And I think the patients get the best quality of care if we all work together.
Well, you said a lot about how you have done your preceptorship in the OR. Can you tell me a little bit about what you enjoyed most and what you enjoyed least about your preceptorship there?
Yes, I was given the opportunity to do my precepting in Winchester's OR. My preceptor was on the heart team, so I loved that aspect of it. I was very spoiled, and being able to see a lot of those great heart and vascular cases. One thing I didn't like was probably some of the attitudes of the staff. They weren't very welcoming to me as a student, but that just made me want to learn more and prove that this is what I really wanted to do. I'm not here just to waste time. I was there to really learn, and I think once a lot of people understood that, they were more welcoming to me. I wasn't just another student in the OR. I was actually there to learn and grow. So my favorite thing about it was I had an opportunity to scrub in on a cardiac bypass, and the surgeon basically threw me in it. He's like, "Oh, you're a student, let's go." So that was very welcoming that he was so willing to let me stand next to him, and he quizzed me a little bit, which was nerve-wracking, but I came out answering all the questions right, so that was good.
So tell me about one of your most memorable events or your patients that you had in the OR.
We had a patient that was actually very chronically ill, and he was getting a fem pop done. So he had a clot somewhere in his arterial space, and because he was so chronically ill, they did not put him under anesthesia. It was all locally. He did have some propofol and Versed to be somewhat sedated, but they couldn't put him fully under because his heart couldn't take that. So that was actually very interesting. We all had to, of course, watch what was said in there because he was awake. And during surgery, a patient's dignity is basically taken from them. And so just being more cautious is what I really liked about that surgery, knowing he was awake and that at any moment we could have lost him. So it was kind of, I don't want to say exciting, but there was a little bit of an adrenaline rush for if something bad was to happen. And luckily he pulled through. He did great through the surgery. So, and he was very positive. He was one of the most positive people I've ever met. And he was a patient that I did actually get to hold his hand and talk to him through a lot of it. So he was a war vet, so he told me how he flew planes, and that was really, I'm going to carry that experience with me forever.
That's a good thing. Now we know we all can't have that experience every day.
Right.
So tell me about a time where you had a difficult situation, not necessarily with the patient, but with fellow staff members and how you overcame it.
That's a really good question because I did have problems with the staff welcoming me. There was a situation in a case where we were prepping for the case and getting the room set up and pushing the room. There was a certain employee that was setting up the table, and she was all sterile, and there's times where you have to, take the instruments out of their container, and before you put them on the sterile field, you have to check this paper to see if there's any holes in it, because if there's holes, then it's been contaminated and you can't use it. So I was checking that, and a comment was made, like, how is a student doing this when this person can't do it? So I stepped back from the situation, and my preceptor went on doing it, and I just kind of, took a deep breath and was like, no, I want to learn this. I need to know how to do this. So from then on, I continued to check the paper, but I had my preceptor check as well, just so that she knew I wasn't trying to make a mistake. If there was a hole, then I was obviously going to say it. If there wasn't, I was honestly not going to say it. So after that, she was a little more trusting in me, and so that was a hard little hill to climb, but we got there.
Well, that's good that you were able to overcome that. It seems like you are kind of able to make decisions like in a tough situation pretty quickly. How would you say? Am I correct about that?
Mhm.
Like, how would you describe your decision making?
I would say my quick critical thinking is there. I am able to do it. I have been under some stressful situations in previous clinicals and in the operating room for precepting where I've had to do an action without even thinking actually. So over the past years of being in nursing school, I feel like a lot of things are just becoming second nature. There was a situation we were doing a gastric bypass case, and my preceptor was on the phone with another physician because the surgeon that was working was asking the physician to come help. And scrub tech asked me to hand her an instrument. I can't recall what it was, but when I went to open it, the bag ripped. So I couldn't hand it to her. So I had to just toss it to the side, run out into the sterile core, and get another one without even asking my preceptor because she was busy. So instead of thinking, oh, where is this, I just immediately went and knew where it was. So I was very happy with that because the surgeon really wanted that now. And I had already made the mistake once, so to be able to think quickly and grab the material that was needed made me feel really good.
Well, how would you say that? Kind of change the tracks here. What do you kind of need and expect from your supervisors?
I expect my supervisors to help motivate me. I expect them to check up on me to make sure that I am meeting all their expectations. Even though I think I'm a very well candidate for this position, I don't want them to just throw me in there. I like supervisors checking up on me. I like them acknowledging when I do something right, but also if I'm doing something that they don't like, please pull me aside. I'll take the constructive criticism. It's only going to help me and not hurt me. And it's definitely going to help the patients. So I definitely do expect supervisors to come check up on me. I expect them to give me confidence and help push me to meet their goals.
Okay. Well, do you have any questions for me? I know I've been asking a lot of questions, and we very probably would like you to be on this team. You seem like you'd be a great fit. So, do you have any questions about us? Because I want to make sure that you feel comfortable on this unit.
Well, how long is your precepting? How long do you expect me to work with another nurse until I'm ready to go on my own?
Well, on this unit, we do a 6-month orientation.
Okay.
That you have a preceptor that you work with.
Okay.
We can work on, if you feel still uncomfortable after that 6 months, you're still on probation at that time because you haven't been here a year.
Right.
But we can work with you.
Okay. And do you all do sign-on bonuses?
We do actually. That was one of our incentives for new grads. Is right now we're doing a $5,000 sign-on bonus with us.
Wonderful. Wonderful. All right. Well, I think that's all the questions I have at this moment.
Okay. Well, we'll be in touch with you. Okay?
Thank you.